let's go ahead. Let's go ahead and get this Kahoots done. Give me 1 second. So far the exam looks good for everybody. Your scores will be out about noon on Saturday. What we do is we get together, all of us, there's 5 of us, and we look at the questions and we determine, were they fair? I know of 2 questions so far that I'm going to say I don't like. So that's 4 points. But this is something we all have to agree with. So just to know that we are fair with all of your exams and we tried to look at those things. That paper is due week 8, but if you look at what communities do at that time, you guys are going to be up to here with paperwork, and it's right around Thanksgiving. So get it done, at least pieces of it early, okay? It's 3 components. Your diagnosis does not have to be what's listed. It's just a guide if you can't think of anything else, okay? You can say, my child, my next door neighbor, my best friend, my aunt, my uncle had this. I want to know more about it. And that's the diagnosis that you should do. Something that's close to home, something you want to know more about. I need more people than just 4. All right. Good job. So week 4, it is 3 chapters. Chapter 39, please look through the PowerPoint. Very important concepts there. So early detection of a hearing impairment is critical. Which one is of primary importance? Well, when you think of hearing, what does hearing affect? When you don't hear well, what happens? Well, it could be a lot of those things, but what's the main thing?
Speech.
Absolutely. So if you saw a child whose speech was garbled and you was not understandable, first thing before anything, you're going to do a hearing test, making sure they can hear. Yes, very good. A multi. A toddler playing outside gets a laceration on his forearm and he needs stitches. What can make this easier? You know, toddlers don't want to be held down. They don't like needles, just like preschoolers. So how are you going to do it with the least stress on this child? I mean, always remember that pediatric should be as atraumatic as possible, right? That's always number one. It's using numbing cream, but use that distraction by that child life person. I worked at Nicholas Children's in the ER, and they had child life. We had stitches, or we had IVs, we had something. Child life would come down, and they would distract children, even during things like lumbar punctures. They knew how to go in and be sterile with it, and it really, really helps for these children to understand, touch some of the equipment. I mean, needles, no, but other stuff so they know what's going to be happening. Child life's amazing for that. So a parent recognizes their toddler as a speech delay compared to their older siblings. What's your priority? Speech delay. What's your priority here? So remember, if they're not talking well, first do a hearing evaluation, and then you can work out all the other things. And of course, give them speech therapy. But number one, before just starting therapy, make sure they have good hearing. A multi. What are signs of an early indicator of impaired cognition? So we've talked about doing all these developmental stages, and there's so many things to remember. We know nutrition is one of the big factors of good cognition, because we need fuel for the brain. So what would you see if they were impaired? Well, they're not going to be able to do things they should be doing at the age. They're not talking by age one. They should have one words, right? Mommy, daddy, milk, juice, whatever. They can't grasp, not even a reflex grasp. And then children with impaired cognition can't express themselves. So they're going to be having behavior difficulties. They're frustrated. I can't describe what's wrong with me and what I want. And that's why behavior difficulties. A child is being treated for a fever. The reason for treating the fever is what? Well, I'll first ask you, how do you feel when you have a fever? Children with a fever are going to stop eating and stop drinking, and they sit down and don't play. They look miserable. Give them something for the fever, and what happens? All of a sudden, they're running around, they're drinking, they're eating, and they look better. So it's only for that discomfort. And with children, remember, fevers burns off fluids. We want them to drink. So at least they're drinking, which is treating their fever. That life-threatening things, there only happens when you have no fever, and then half an hour later, you have 101 or whatever. That rate of rise is quick, and the brain sparks, doesn't like it, and you have a febrile seizure. And that's usually ages about 6 months to about 6 years. They usually grow out of it. A multi. A child's complaining of something that's in their eye and it's causing them tearing and it hurts. It's painful. What do you do? Eye injuries are really important because, children are always poking, falling, things in the eye. So, what is the treatment with that? Well, if we see something floating, we could take the little tissue and get it out of there. Um, if you have light, you're going to check pupils because no reaction to light is really an ophthalmic emergency. And if there's something stuck in there, don't pull it out, leave it there. And we put what we call a Fox shield. And it's not like a gauze that will touch the eyelid and smush that further in. It's hard, it's rigid. You put it on there, tape it on the eye so that it protects from anything else pushing it in there. And get them, of course, to ophthalmologist or into a pediatric ER that has eye doctors. So separation anxiety in child hospitalized, which behavior indicates the stage of despair? Now, separation anxiety is three different stages. When you leave a child in the hospital, toddlers, preschoolers especially, mommy has to go home. What's the kid going to do? Going to cry like crazy, right? And then they go into the stage of despair where they start sucking their thumb again. They regress or they're potty trained and they start urinating, wet in the bed, which they haven't done. And then the third stage is finally mommy gets back and the child ignores the mother. They don't want to go through that crying routine again. And that's why there's three stages. If you don't understand it, just go back to the book or go to the PowerPoint. It shows you more. So, a child with a history of abuse, which therapy explores those emotional problems? Because remember, children don't always know stuff that's abusive. It's something that, oh, I've been abused like this, and this. You as an adult would know they don't. So they use play therapy and you play with dolls, or if it's a male doll and a female doll and a teddy bear, or whatever that, situation that you have a little inkling of. And it's done by either child life or a psychologist. And it does really let the child express what happened. A multi. When can children react to the stress and anxiety of hospitalization? So, stress and anxiety, hospitalization, absolutely. All kids do. No kid wants to go to the hospital, stay there. It's a strange place, strange noises. And we're people who's always touching and prodding and squeezing them and making them do things. They don't like us. Now, they could be upset before, during, or after. And actually, you will find out those children who have more hospitalizations, for instance, child with cystic fibrosis, a child with sickle cell that are in and out more frequently, probably had a bad experience. And those children actually have more stress and anxiety than that child who's never been there. Okay. A multi. An adolescent goes to the ER for treatment without his parents. How do you get consent for treatment? You know, there's all types of adolescents. We have the emancipated minors, right? We have minors that adolescents that are 18 years old, right? So if they're 18, cognitively aware, you don't need parents. In fact, if they're in the hospital with the parents, you've got to get permission from that 18-year-old if the parents can listen to what's going on with that doctor and if that doctor can talk in front of them. Okay. Also, child comes in, trauma alert, etc. You don't need any consent. Two physician signatures suffice, and they say once the child's stable, then you can get the consent. And that's Florida law and most states' law. Also, child comes in, let's say with a next door neighbor who was watching them, they can do a telephone consent. Remember, there's always two witnesses for that. And it could be the ER clerk that does that. A child's extremely fearful of hospitalizations. What type of play explores these fears? You know, it's why are they afraid of that fear, right? So this is called dramatic play. All right. Dramatic play means this is what I'm afraid of. It could be of machines, could be of x-rays, could be of people, could needles, whatever. But that dramatic play will show us what they're afraid of and try to help them not be. So you're checking the IV on an infant and you notice the tissue around the IV is swollen. What do you do first? What's priority here? And remember, infants, 10, 20 mLs of fluid is a lot of fluid on them. So our goal, stop that infusion, most likely take it out, put some nice warm pack on it, hospital approved, and elevate it, and you will see that swelling go down. In helping a child to adapt to a hospitalization experience, the best approach is, we've talked about toddlers and preschoolers, infant really not as much. And, even some of the younger school age children, they're in this experience, they don't know what's going on. And one of the things is to put them on a schedule. What are they used to? If you can, the same foods that are at home, right? Same bath time. If they change their clothes, change their jammies first thing in the morning, whatever it is. And it really does comfort them. They know it's coming. So, in assessing the vision of a child, the healthcare provider would use the Snellen chart at what distance? I just took you back to health assessment, didn't I? And remember, there's different things. It doesn't have to be letters. It could be animals. It could be colors. It could be anything that that age child would understand. And they can do really well using selling charts on younger kids, as long as they know, it's a pointing which way and they can show you, or even those animals type things. Another multi. Nursing care of discharging a child to home. So child's all better, going home. Mom's there to get them. What do you need to do? Only giving the instructions to the parents, preschoolers and even toddlers, talking to them, they sort of understand what's going on. So always include the child in it. Of course, older children, they're more apt to understand it, but, talk with that child there, let them know what they should expect in that child. Your child had surgery. You should be expecting this. Emergency phone numbers, and then have that parent verbalize the understanding. What are you going to do if? What is this? What is that? You quiz them, making sure they're being sent home. What is a 3-year-old biggest stressor of being hospitalized? This is just the beginning of preschooler, the end of toddlers. What's their biggest fear? And I could say it's all of them. Your biggest one is separation from the parents. That's why we encourage parents to stay with these younger children as much as possible, especially toddlers, especially them, but also preschoolers. A multi. What is the best way to alleviate the stress and anxiety of a hospitalized child? I could say just about everything there, don't I? But what's the best way? And the best way is allow the patients to stay there, parents to stay down, same routines, and then get on their level, developmentally appropriate terminology. Yes. And we don't do these invasive procedures in the room. That's their safe place. You would take them to a treatment room. A nurse notes a string tied around an infant's wrist. An appropriate nursing intervention is what? Now, when I came to Florida, they had these little things here. They're black, but mine is blue. And a lot of my infants had it on. And I'm like, I don't know what they are. So what did I do? I asked the parents, what was it? In fact, then that parent gave it to me. And what it was is it wards off bad thoughts against me, that nobody wanted bad doings on me. And I thought that it was an honor that a parent did give it to me. And I've been wearing it now for about 20 years. So it's ask the meaning, leave it there. It's not hurting it, leave it on there because it makes the parents feel better about their child. And that's okay. So how can a hearing impairment develop? Any of these could happen, right? But what about if they're in the hospital getting these aminoglycosides like vancomycin? They're all ototoxic, aren't they? That can cause problems. What about noise? Noise is a big thing we don't think about. Putting headphones if they're going to, the big loud music. Those things are important. So all those and so many more. Which urine collection method on an infant is most accurate? Now, infants don't have immune systems, right? They're very minimal. So we want the best specimen the first time to put them on one antibiotic. We don't want to have them still sick, have to redo the urine and redo an antibiotic. So it is a straight calf. Now, bag urines are older children, okay? And it's not for a culture. Remember that culture, the bag is going to get all skin contaminants on it. So, straight calf, especially for your young infants, your older children, that clean patch, that midstream. I've seen that done. They wipe them, they stand them on sinks and on toilets and hold the cup and they go grab it and get a midstream in it. And it does work well. But infants, it's a catheterization. Multi. What is the purpose and function of the family? We're in family centered care, right? So it's a safe environment, it's emotional comfort, and of course, it's their values and cultures. That finance, we don't look at that. We're just looking at what the family does for that child. The primary goal in caring for the child with cognitive impairment is to what? You have a child who's delayed, Down's syndrome, could have been some sort of hypoxic episode, cerebral palsy at birth. All of these children will have some cognitive impairment. It's our goal. Years ago, we didn't do anything, but today it's to promote optimal development. That is teaching them colors and teaching them letters and shapes. I've seen severe nonverbal spastic cerebral palsy children be able to look at shapes and look at colors, and they would point to, they have a little screen that they would point to, and they were smart. Years ago, we didn't do that. So it is warm to see that they're at least teaching them something. So many infants require oxygen. What type is best tolerated and accurately delivered? And the one thing about this one to remember, anything taped to the face is going to annoy an infant, and their little fingers come up and rip it off, and the tape rips their skin off with them. So if you saw that picture, that's what we call an oxy hood. And it is accurate. They have a little monitor in there. You can adjust the flow rate. Child can look around, suck on his fingers, suck on your pacifier, and they're happy. It's a better situation than a nasal cannula where you just rip it off the tape because you tape it on to hold it there. What is the best practice for school age children with special needs? Remember, special needs could be that child born with like myelomeningocele, so like spina bifida. They can't move from the waist down or minimal movement, but their brains still work. They're still smart. What are you going to put them in a special classroom because they can't walk? Absolutely not. So we are putting them into regular classrooms. I had Manuel Louis with my myelomeningocele came to see me when he was 14 years old. I didn't see him from birth to 14. The mother saw me and goes, "Ah, Betty." So I went out and the mother told me that he had just gone to his eighth grade prom. He was a good student. He was in regular classes. And she gave me a hug and thanked me for all the encouragement when he was a newborn. So, yes, we can integrate them very, very easily. A multi. Collecting a heel stick blood specimen on an infant. How do you do it? Really, the only time you need to do a venipuncture on an infant is blood coagulopathies, your PT, PTTs, fibrinogens, those things that, require blood from a venipuncture. The rest can do it on a heel stick. 1.2 mLs is a CBC and a complete chem profile. So it's not that much. It's the outer aspect, not in the middle, because it will hit the bone, the calcaneus bone. Now you got osteomyelitis. Also, make sure that you have an infant, lancet. You don't want it too deep because then it can create damage. It's like sticking a knife into, us. And of course, only a hospital-approved heel warmer. You don't want to burn that child's foot. Referrals for cognitive impairment should occur when? So you're seeing delays in this child. They're not turning over, they're not sitting up, they're not walking, they're not talking. When do you start a referral? Which means early intervention, which is speech, physical, occupational therapy, and yes, as soon as you possibly can. Kids catch up quick. So Down's children have frequent upper respiratory infections. Why do you think so? I mean, any of those things you could think. There's one main one that causes frequent. And it is that flat, underdeveloped nasal bone. The mucus gets stuck, it drips down, causes coughing, and it causes all those upper respiratory infections, and they can't blow it out. A multi. What would be included in the care plan of a patient with moderately cognitive impairment? What do you think would help them? Keep them calm, know what's going on, help them advance. And it's that structured routine that's number one. And then exposure to sight, sound, sensations, toys that are appropriate and that are safe. Remember, you might have a 5-year-old child, but they're cognitively impaired. Remember, they put stuff in their mouth they could swallow and choke. Okay, so always appropriate with safe toys. Multi autistic children demonstrate which behaviors? Now, autism is usually not diagnosed till age 2 or 3, but up to that point, there's little clues that we see. So, language delays, developmental delays, absolutely. They don't look at you, they don't like lights, they don't like loud noises. They sit by themselves and they're not going to respond to you. And this is all part of what these children do. Now, one of the ways to treat them is routine, and not accepting bad behaviors. I've seen severely autistic children that were Downs also amazed at walk into the daycare, put their backpack in a cubby, sit down, wait for vital signs. Yeah, might have to be reminded to sit quietly, but then would go off and play. Amazing because of structure and routine and not accepting bad behaviors. A multi. Children with autism have better outcomes if that's structured. You teach them how to talk because they're maybe not verbalized, but maybe they can show you what they need. And of course, none of those unacceptable behaviors. And therapies, it could be a mom and dad. It could be their siblings at home. It doesn't have to be licensed, okay? Because that continuation at home helps. A multi. Fragile X causes. Now, Down syndrome is number one cognitive delayed syndrome that we see. Fragile X is number two. They're very similar, but they're cognitively delayed. There is some physical deformities, big ear, big jaw, but these children are aggressive. These children require medicine to keep them calm. They don't know how to control it. So, all of the above. Causes of autism. It's many times it's males. I worked with one nurse who had a boy and had another boy a year later, and both of them were autistic. About 4 years after that, she had a little girl and wasn't, and she's worked very hard with them. But we don't know why. We wish we did. So genetics, abnormal brain, unknown, hypoxemia at birth, it's really not known. And it'd be one of those things if I was in research, I'd love to research. So ways children with hearing impairments communicate with each other. Children can be of different languages and sit there and play and they know how to communicate, right? So we know it's, language and sign reading and all of those things. They just make it themselves understood. Now, amblyopia is what? Well, it's something to do with the eye. Now, there's 4 different eye things that you need to know about. Amblyopia is one of them. What would be the name for that? And it's called a lazy eye. That means one of the eyes is crooked. It doesn't, go center like the other one. Now, how do you treat amblyopia? Well, the eye is lazy, so you need to make it work. Put a patch periodically during the day over the good eye and let the muscles of the bad eye work, and those muscles will strengthen. How would you help encourage a preschooler to be less apprehensive when taking their vital signs? We know you have to go in, get on their level, sit below them, open up with some, you've got cute eyeballs, whatever, but let them, if it's appropriate, touch and play with the equipment. I think the blood pressure was the hardest thing for vital signs with this age children, but I let them push the button. I do me first. Oh, look, my last number is a 6. What's your number going to be? And we make a game, and that's all they needed. And they push the button and get a blood pressure. So, what child may be more stressed when hospitalized? Absolutely the one who's in there more frequently. Most likely they've had a bad experience, and that's when they get stressed for it. As I said, the other children maybe be excited because it looks like kids and it looks like fun, depending if they were pre-opt and, taught stuff first. But one who's in there a lot, that's the one who's scared. A toddler has a hard time fixating on a single point. The child's eyes cross. This is another one of the eye problems. We have farsighted, we have nearsighted, we have amblyopia, and then we have strabismus, and that is crossing. That's crossed eyes. Now, there's another one where the eyes sort of twitch. That's nystagmus, okay? So we have amblyopia, strabismus, and nystagmus. A multi. Safety in administering medications to children include there really is no difference between children and adults, except for, of course, we know that calculating that dose, right? But the rest is all the same. So that's the one that you're going to check an ID band, not a room number. What can help the parents to make a baby swallow their medicine? So many babies spit it out. They don't want to. You squirt it in the side of their mouth and they're just don't want it. Well, what I have learned is you teach the parents. You take a deep breath, put it in the side of their mouth and blow hard in their face and they swallow it and it works really really well. I mean, you might have to pinch their cheeks a little bit until you blow, but and they swallow it down. Treatment for amblyopia involves, what did I tell you? So they got a lazy eye, make it work, cover the good eye and let the lazy eye work. The nurse is discussing sexuality with the parents of an adolescent with cognitive impairment. It's important. So you have an adolescent with, let's say, Down syndrome. What when discussing sexuality, like why would you do that? Well, do they understand good and bad touch? Do they understand what's right and what's wrong? Right? So this is all about a concrete, well-defined code of conduct. So if an adolescent gets touched in the wrong way, that's, not really understanding, they know when to say, Mommy, this happened to me, because we don't want them to be abused. A multi. A child's asking mom about his sibling in the hospital. How can you alleviate his stress and fear? I mean, we're lucky today we've got FaceTime. I mean, years ago we didn't. But still, they're worried because they can't always speak to them, right? So, what can this sibling do? Whether the one in the hospital or the one at home, right? I mean, I've done a lot of different things. I've had the ones in the hospital make a card, or I'd send home a coloring book and crayons, or little girls, little ribbons that I make. Or if they're coming to the hospital, and especially if they're in an ICU, let that child know what to expect, what noises they're going to hear, so they're not fearful about it, okay? You don't want it to be a frightening experience. Multi. What are some best practices when a child is in pain? You're always going to see pain questions on your NCLEX, on your HESI, on exams. It's just going to be there, whether it is those scales that we use or how are we going to give pain medicine. So give it as ordered, exactly as ordered. Use distraction. It could be turning on music, TV, giving them a pad, let them play Roblox, right? They love Roblox. Position the child. They had abdominal surgery, they're laying flat, elevate ahead of a bed. And then, of course, if we're doing any treatments like incentive spirometry, pain medicine first, let it work, and then do the incentive spirometry. Multi. Children can be critically ill for long periods. How do you prevent pressure ulcers? You're thinking, kids, pressure ulcers? Yes, it can happen. Because remember, if they're ill and they're on IVs, are they getting proper nutrition? Skin healing? Are they getting that protein they need? Right? So, what do we do to prevent these things? You're going to keep them dry. You're going to turn them. You're going to use a draw sheet so you don't just whoosh off their skin, because I've seen it happen. And then you're going to use whatever you have to prop them as we turn them side to side. I use little beanie babies to hold ET tubes and put their bear in front of their eyes so they could see them, or put their blankets around them, or pillows, or whatever. Whatever you have, you can use. And last question. How about I? Young children can be stressed by being in a hospital. How can you decrease that stress? So we're not going to limit visitors. I mean, today we're allowed visitors in there, but I'm not going to be 20 at a time, but let them come in as they need to. The routine, the parents, and then bring them familiar items in, like the toys. Let's see how we did today. Number 3, Dee Dee. Dee Dee. 2, Gabby. Good job, Gabby. Number 1, Ray, or Raw, and Martha and Zeus. Good job, guys. I got through that pretty quick for you so I get you out in time like I always promise I will. So remember, you're going to be getting your exam scores back by noon on Saturday. Anybody who gets less than an 80, please make an appointment. I want to go over the exam with you. And even if you got a 96 and want to know the 2 questions, that's okay with me too. Make an appointment, and I'm not going to keep you for an hour. I don't do those things. I know your time is very, very special, and I'll work in your time frames. So thank you, everybody. Remember, send me your nursing diagnoses or what your pediatric assessment is, okay? Think about it. You're almost there. Good night, guys.
Yeah. Bye, Professor. Thank you.
Very, very welcome.
Good night. Thank you.
You're welcome.